So pleased to have Julie Rovner here today. She covers the White House, Capitol Hill, Health and Human Services, issues out there in the states, across the countries. She was NPR's lead correspondent on the Affordable Care Act, which of course is going to be part of our conversation today. And I'm also very proud to say that Julie is a previous winner of the National Press Foundation's Dirksen Award for Distinguished Reporting of Congress. So Julie, welcome.
Thanks for having me.
You have been covering these issues for NPR for a very long time, including all the political aspects. In fact, you've authored a reference book, I want to get this right, Healthcare Politics and Policy A to Z.
That's right.
So maybe this is a good place to start, because I'd like to talk a little bit about the history of this controversy. We just passed the anniversary, the 40th anniversary of Roe v. Wade. Is that where this really started 40 years ago?
It's not, interestingly enough. I just did a story on that this year, and I've been covering this for about 27 years now, since before I came to NPR. I have not been covering it for 40 years. I'm not that old. But I actually did a very interesting story this year. There's this sort of, I won't call it a myth, but there's this sort of understanding from most people that's sort of grown up over the years that the Supreme Court, in legalizing abortion nationwide when they upheld abortion in Roe v. Wade, sort of nationalized this issue, that abortion had been sort of happening, a number of states had legalized it leading up to Roe v. Wade, and that by making it legal in all 50 states at once in 1973, the Supreme Court kind of, lit the kindling, if you will, to make this a big issue and kind of made the anti-abortion movement what it is today. And it turns out that's not necessarily the case, that this issue was really a national issue before that in fact Richard Nixon in his campaign had decided that he was going to maybe try to get Republicans, Catholics in the North who had been voting Democratic to vote Republican, and they'd been very anti-abortion. Obviously they're Catholic, and perhaps that by coming out as an anti-abortion candidate, he could kind of lure them over to his side. That was recommended by some of his advisors, including one Patrick Buchanan, who was very young at the time. And so that was one of the things that was sort of pushing this to be more of a national issue. That obviously predated Roe v. Wade. So there were a lot of things going on really in the late 1960s and early 1970s before Roe v. Wade. So it turns out that it's something of a myth that Roe v. Wade turned this into a national issue. It was getting there all on its own.
Wow. So this has really been a political issue well before what's happening today.
Clinic was raided, and the horrors there were, unveiled, and I think they saw this as an opportunity to use it to their advantage, both from a PR point of view and from a legislative point of view, and they were not shy about saying that they wanted to use this to try and, shock the public, if you will, into imposing more restrictions on clinics, and try to use it to advance it legislatively. Here at the federal level, they used it. They were not shy about this, to say that they wanted to use it to advance this, federal 20-week ban. This has been something that's been going around in the states. We've seen, I think we're up to a dozen states now have some iteration of a 20-week ban. The Republican House had tried to pass it last year, just applying to the District of Columbia. The Congress, of course, has special powers over the District of Columbia, but this year they took that bill, which failed, by the way, last year. How much things changed, how quickly, and they decided to expand it to a federal ban, and they got it passed in the House. It's not considered to be going anywhere in the Senate, still controlled by Democrats, but again, this was something they wanted to use, mostly as, I won't call it a publicity stunt. It's all about PR on both sides, and this is something that they're using for their PR effort.
So when we talk about 20 weeks, just to be clear, we're talking about a bill that would ban abortion after 20 weeks. Either 20 weeks after conception, if that's how you want to count, or 20 weeks after a woman's last menstrual period, if you want to count that way, which I think, if I remember my biology correctly, would actually be 18 weeks after conception. approximately.
That's right.
So that's fairly early in a pregnancy.
In covering these bills, this is one of the biggest traps that you can fall into. These quote-unquote 20-week bills are all written very differently, so they are not the same. The Arizona law, which was recently struck down by a court of appeals in San Francisco, was said it was a 20-week law, but it was a 20 weeks from last menstrual period, which is how many doctors measure pregnancies. That would make it really, though, an 18-week. It would be 18 weeks after conception in all likelihood. So that was really considered by many people an 18-week bill. The federal law was 20 weeks after conception. So some people, in fact, I think the New York Times was counting it as a 22-week bill, because it would really be 22 weeks of pregnancy. You have to be careful with this. It's sort of 20 weeks of what as a journalist, when you're writing about these, because they're not always comparing things properly. So yes, there are 12 quote-unquote 20-week laws, but they are not all the same. And the Guttmacher Institute, which I think we'll talk about later, has done a chart of all these 20-week laws, but it's filled with so many different footnotes because they all measure themselves differently.
Interestingly, though, one of the issues around the 20-week bills has been the idea that at some point, some people say that the fetus can begin to feel pain. But I don't think, and I think that's unclear, we really don't know the answer to that, but I don't think anybody would argue that a fetus is viable at either 18 weeks, 20 weeks, 22 weeks.
That's correct. The justification for these 20-week laws is that at 20 weeks, that is when a fetus can begin to feel pain. There are a couple of scientists that have written papers. They are highly contested scientifically, but that is the written justification for why 20 weeks. Viability, and remember the Supreme Court, at least up until now, says you cannot ban abortion and up until viability. You may ban abortion after viability, but only with exceptions for the life and health of the woman. So up until viability, at least right now, in fact that was why the appeals court struck down the Arizona law, because they said currently the Supreme Court says you can't do this before viability. Viability right now is considered around 23 or 24 weeks, but again, it's 23 to 24 weeks last menstrual period. So again, so there are arguments that if the 20 weeks where you can feel pain and the 23, 24 weeks of viability are actually relatively close together, but no one is suggesting that they're crossing. There is still a gap between where these 20-week bills are and where viability is, and everybody agrees that it is still before viability. And so the current Supreme Court holding is still beyond where these laws are.
Okay. If that's the case, if there is that gap, why are they continuing to pass these bills? Why are states continuing to do it? Why did the House just do it? If we know that essentially what you're saying is it's in conflict with what the Constitution
because
says right
they
now.
would like to get to the Supreme Court and perhaps have that fifth, what they're hoping to be a fifth Supreme Court vote to change what is the current Supreme Court holding, which is that the last Supreme Court case was on the partial birth abortion ban, and as one of the anti-abortion advocates pointed out to me at the press conference on the federal 20-week ban, every single lower court in the partial birth abortion case also struck that down until it got to the Supreme Court, in which, in fact, the Supreme Court struck it down the first time, too. It had to go to the Supreme Court twice. It wasn't until the second time that the Supreme Court upheld it. So their argument is, yes, in current Supreme Court precedent, it would be struck down, but that's not to say that perhaps by the time it would get to the Supreme Court, maybe the Supreme Court would change its mind. That is the current argument.
Abortion is being challenged not just by these 20-week bills, but also by lots of other measures in states around the country. Can you talk about that a little bit? What are some of what's happening and what are the implications?
Yeah, there's a lot of laws that seek to basically ban abortion by making it unavailable, essentially. They're essentially trying to regulate it out of existence, and I think the anti-abortion movement does not deny that that's what they're trying to do. Basically having to require abortion providers to have have privileges at hospitals. Well, many hospitals don't give doctors privileges unless they're actually practicing at the hospital. Well, abortion providers don't tend to need to practice at hospitals because abortion tends to be a relatively safe procedure, and women who have abortions don't, in most cases, don't need to go to the hospital. So if you're basically providing abortions, you'd have no need to have patients in the hospital. So you wouldn't need you wouldn't need hospital privileges. It's sort of a catch-22.
Right.
There'd be no reason for you to have hospital privileges, and therefore hospital wouldn't give them to you. That's a classic example of why you would not. Many of these practitioners are not, sort of your standard, and abortion really has been stigmatized, and a lot of standard OBGYNs don't do abortions because they're afraid they'll then be stigmatized and won't be able to continue to do the rest of their practice. It is a lot of chicken and egg, so you end up with physicians who are sort of only doing abortions, but then again, they can't get hospital privileges, so that's sort of classic example. The Texas law that is now so much in the news basically would require affiliations with hospitals, which if you're in a city, not so difficult, but if you're in a rural area, I think it says, I can't remember, it's 30 or 50 miles, which is fine, but in a very rural state like Texas, often there isn't a hospital within 30 or 50 miles, so it would end up sort of forcing the closure of many of the abortion facilities in the state. I think it's 2/3 of them, or maybe 3/4. I've seen the map, can't remember exactly. So in Virginia, we've seen a law, and Virginia's not the only one, several states where they basically would require abortion clinics to meet all the standards for a surgery center, which they say are safety considerations, and some of them are safety considerations, but again, these are often not the kind, many of these facilities are only doing first trimester abortions, which are relatively minor procedures, and they don't need to come up to the kinds of codes that you're doing if you're doing, more invasive sorts of surgery. Again, many of these clinics can't afford to come up and meet these types of requirements, and it would put them out of business. So those are the sorts of things that we're seeing in many states right now.
So as a journalist, if I'm in a state and I see that there's a move afoot to limit or to place extra restrictions on clinics or their doctors or so forth, how do I report that from a fairly a neutral perspective? Because certainly there are people who will say, this is not a war on women. We are trying to help women. We want to keep them safe during these medical procedures. Yes, they mostly are safe and they mostly go fine, but what about that 1 in a million who starts to bleed out on the table or something terrible happens? As a reporter, how do you deal with that?
It's difficult. I mean, particularly in these cases with these, these safety restrictions and these these health requirements, and there have indeed been cases. I mean, just in Maryland, we saw they went out and they did a number of inspections, and they found some facilities that were clearly not up to standards, and they closed down a number of facilities. As a reporter, you clearly have to go out and try to figure out what's going on. I mean, the most difficult part of covering this issue is finding somebody who's neutral. It's everybody, most everybody is on one side or the other.
Right.
Obviously, if you're in a state, you're going to have a state health department. Sometimes the state health department is a political appointee and is on one side or the other. You're going to have to try and figure that out. But most often, if the person is not a political appointee, is a civil servant of some sort, you're going to have to kind of trust your gut, trying to figure out if that person really is just there, trying to do their job and make sure that the public safety is protected. But often enough, people on one side or the other are willing to say what they're out to do. Many of the anti-abortion groups are willing to say our goal is to to restrict abortion out of existence. They're not particularly shy about this in most cases.
Right. Well, I'm really glad that this came up, and I think the important takeaway for journalists is to help your audience see this line between the Kermit Gosnells and the clinics that may need additional regulation or may need to be closed down because they're an exception. Abortion and birth control blurs a little bit when we start talking about the so-called morning after pills.
It's called RU486 or Mifeprex. It's sold under the brand name Mifeprex. It is highly controversial, but it is not the same as the morning after pill or Plan B. You take the abortion pill after you're pregnant, somewhere around 6 weeks, and it will basically cause a very early abortion. That is different. It's called a medical abortion. You have it instead of a surgical abortion.
And is that legal in the U.S. with a prescription under a doctor's care?
Yes, with a prescription under a doctor's care. It is highly regulated.
Right.
It is something separate. It is not part of this. I know we're going to talk about this. Not part of this birth control mandate that comes with the Affordable Care Act. It's something completely different. The morning after pill is basically a high dose of the same hormones that are in regular birth control pills. You take it after unprotected sex. The most common morning after pills work up to 72 hours after unprotected sex. There's a new one that was approved in 2010 that you can take up to 5 days after unprotected sex. That's called Ella. That one's available still only by prescription because it's very new. The other one, the Plan B, is the one that just was finally made available to everyone over the counter without a prescription. So it's called levonorgestrel is the name of the hormone in that. But both of them, both of the morning after pills are basically just the same as regular birth control pills. They've been used for years, sort of underground, prescribed by doctors. And the FDA actually went out and asked drug companies, why don't you package this in a more easy-to-use, consumer-friendly way so women will be able to know if something's happened and they need this in an emergency, why it's called emergency contraceptive, they can take it after the fact. And that was how it was created finally in the late 1990s. And it was originally a prescription product, but in 2000 and the end of 2003, two FDA advisory committees said, Ruth, this is really very safe, easy to use, should be available over the counter, and then we've been arguing about it ever since.
Yeah, I was going to say, I'm surprised that the FDA would opt for more friendly packaging when it seems like the FDA has been the one trying to put the brakes on in recent years.
The assumption has been that there's been political interference on the FDA. That's, in fact, and of course, since 2011, we know there's been political interference because the FDA in 2011 said, we find this completely, safe for over-the-counter use, and it was Kathleen Sebelius who stepped in and said, no. I know you do, but I'm not going to let you do it. So, and then there's a lawsuit, and it's been a very long and involved and trying issue for lots of people.
And I'll put in a plug for the great timeline that is at npr.org, and you can probably search Julie Rovner and find it that way.
Yes, thank you. We just put it up a couple of weeks ago.
Yeah, and I looked at it a few days ago, and it's really quite a cool tool because it takes you through the entire torturous path of Plan B with a lot of detail, and you can kind of go in as deep as you want and look at the timeline in different ways. So very nice little app that you threw in there.
I think I covered every one of those events in that timeline. Including 2001 when they first filed the citizens petition to ask for Plan B to be made available over the counter. And I remember they said at that press conference we would know in 90 days. So that was 11 years ago.
Yeah, wow. It's been a long time.
But as to how it works, I mean, that's sort of interesting because at the time when I first started writing about emergency contraception, it was thought that one of the ways it might work was by blocking the implantation of a fertilized egg.
Right.
And that was controversial. There were people who thought that was tantamount to a very early abortion. Now, this is not the same as the abortion pill, which actually does interrupt an implanted egg. I mean, it does. The abortion pill does stop an existing pregnancy, but there was thought that perhaps the morning after pill might stop a fertilized egg from implanting. More recent studies have found that at least levonorgestrel, the Plan B and Plan B's generics, do not work that way. It actually only works by stopping ovulation. So in fact, I talked to some anti-abortion activists who now concede that is not the way that Plan B works. So when you see a lot of these arguments about the birth control mandate, and they talk about abortion pill mandate. That's really not accurate, at least when it comes to Plan B, because we know that Plan B doesn't work that way. Plan B does not stop it does not allow an egg to become fertilized, because it does not allow for an egg to be released. It stops ovulation. That's how it works. And its failure rate is because if you take it too late, if ovulation's already happened, then it's too late, and then that's what the failure rate is about, at least with Plan
Right.
B. And that's because that's from more recent studies that we've seen.
I
Just
feel
since
like-
this fight has been going on.
I feel like we should have opened this webinar with the big posters explaining how conception happens.
Well,
because I suspect there are lots of people out there who really don't quite
But they're
get
learning
the
more. I mean,
various
some of
steps.
this, they've literally learned more about how conception happens since this fight has been going on.
So my recommendation to you is, if you have to cover these issues, go back to a basic biology book or one of those something written for teenagers, and make sure you're clear on all the steps, because there are big differences ideologically between stopping a pregnancy, between not having an egg drop out of the fallopian tube, compared with having that egg fertilized in utero and then implanted into the uterine wall where it continues growing and so forth. So there, ideologically, there are big differences in how people feel about those various points. And it's just amazing that politics is what it is in this country, and we really have to know all this. But it's very important, and it's a very emotional issue.
And I must say, it's one of the, I know a lot of reporters shy away from covering these issues because it's one where you have to know about politics, you have to know about law, you have to know about biology, you really have to, and you really have to know about all three of them in order to cover this issue.
Well, for a long time, birth control, at least, didn't seem like a controversial issue. We had the pill, you could use it if you wanted to, if you didn't want to, that was okay. For many women, it provided a lot of freedom. Suddenly, birth control is controversial again, and I guess it's because the ACA requires that employers cover the cost of it.
And what's interesting is that what the ACA really requires is that they cover it with no copays. When I first started doing this, what was interesting to discover is that a lot of these places, a lot of these religious organizations that are now required to cover it with no cost were in fact already covering it. Some of them didn't even realize that they were already covering it.
Oh, that's so interesting.
Yeah, it was fascinating. A lot of this was just going on without any realization, and I think there was kind of a big freak out because a lot of them were doing it without knowing it, because that was really the big realization. It's like, oh my God, we've been doing this and we had no idea.
Right.
Right.
So where does it stand now? I know there are lawsuits all over the place.
There are literally dozens of lawsuits. I think it's 60. I think we're up to 65 lawsuits. Many of them from where we are. Just to backtrack, there is the administration came out with its final rule last week. If you are an actual house of worship, a church, or a truly, an absolute only religious organization that really primarily hires just people of that faith, you are exempt. You do not have to meet this requirement.
Okay.
If you are a religious organization like a religious hospital or a university or a social service organization, you have to arrange for your employees or your students to get the benefit, but you don't have to pay for it or refer for it or otherwise sort of basically participate in it. It's going to be taken care of through this incredibly Rube Goldbergian process by which the insurer has to do it, so the religious organization can stay out of it. And
sort of hands-off.
Yeah, it's very hands-off.
See no evil.
Right,
kind of.
exactly. The insurer does it, and if you are self-insured, meaning you don't have an insurer, then your third-party administrator does it and somehow gets reimbursed through the exchanges, which is even more complicated. There are those who still don't like it. The Conference of Catholic Bishops is actually having a press conference this afternoon to announce their position on it. I think the fact that they're having a press conference suggests that they're not happy. I'm intuiting that they're not happy either. But
Well, it does
if
seem
you're-
like a little bit of a shell game.
Yeah. I think they're still being, there are those who say, even if you're not doing, you're still complicit. I think that's going to be the argument. There is no exemption though for for-profit companies. So if you're and that's where a lot of these lawsuits are, for-profit companies owned by religious owners saying, how come we have to pay for this?
How that goes. You have, because you cover this all the time, you've got lots of resources, places you like to go to get information on the various things, and it's so complicated. I think it would be really useful. So maybe we could talk about some of those, and we've got screenshots from some of the websites. One of the biggest ones, and one that we've used as well, is the Guttmacher Institute.
Yeah, they're kind of, and I think, those on both sides have used Guttmacher's numbers. People sometimes complain about them, and they've been called, an arm of Planned Parenthood, which they're not. I mean, they've separated. They're just a research group that does reproductive health research, and they do a lot of their own studies, and they have, I mean, that's sort of my go-to place for, just getting what's going on in terms of numbers and studies, and that's...
Yeah, and they cover just about everything you can imagine along these topics, right? Abortion and birth control and
reproductive health, sort of running the gamut.
Right. And is it, are they focused just on what's happening in the U.S., or it's an international
They do some
coverage?
international.
Okay, so that's a very good resource, and it is guttmacher.org. If you registered for this webinar, we will send you, after it's over, a link to the recorded version and also this list of links to these resources. So you will have them. You also mentioned the National Right to Life Committee.
They are the oldest, I think, and I believe still the largest anti-abortion group. They have a very rich website that has a lot of information on it, and a lot of good fact sheets. So that's another place where I go a lot to get a lot of good information.
Okay, and that's nrlc.org, and that'll be on our list. And the other piece of that, the Center for Reproductive Rights.
That's right. They're mainly a legal group. They do a lot of represent a lot of the groups, a lot of the lawsuits. They did a lot of the Plan B, in fact, litigation. So they have, I find a lot of the legal pleadings on their website. And they have very good. They'll have the history of a lot of these lawsuits on their website, which is where I get most of that stuff.
Right, and that is a terrific resource if you're covering these issues, to be able to go back to the actual pleadings, the actual lawsuits. You're really doing original source reporting, so that's really helpful. And I just want to make the point, obviously, as a journalist, you know this, but anytime you're using information that comes from an interested group, you need to be aware of that. If you're quoting them, you need to make that clear in your coverage so that people understand where your information is coming from.
And they tend to get the legal decisions up really fast, which is really nice, because getting
helpful
stuff through Pacer, if you've ever gotten stuff through Pacer, it can be very tedious.
Right. Okay, good to know. There's also the Susan B. Anthony list.
They're sort of a newer upstart anti-abortion group, but again, they're very active, but mostly aimed at women anti-abortion activists.
And what kinds of things will you find on that website? That's sba-list.org.
What's useful for me as a radio reporter is that they tend to archive a lot of audio. I get a lot of sound off of their website.
Very useful.
Which has actually been particularly useful. That's what I use a lot of I often use their website for.
Okay. The ACLU Reproductive Freedom Project.
Again, like the Center for Reproductive Rights, I tend to find a lot of legal pleadings. They're also very good at archiving and getting up a lot of legal pleadings.
Good to know. And the Beckett Fund for Religious Liberty.
Again, they're an anti-abortion law firm, basically. They've also been good at keeping track of all the various. They've been very active on these the contraceptive coverage lawsuits, and I think they're representing a lot of the plaintiffs in a lot of those suits, and they've been really good at keeping track of where they are and where they're going. So that's been very helpful.
Yes, that is good to know. We have a question from Twitter, or from our chat, asking what rights clearances are necessary for use in broadcast. Are they talking, maybe you're talking about to broadcast this webinar? I'm not quite clear on the question. But I can tell you that we will be posting a recorded version of this at our website, and you are free to pick that up and rebroadcast whatever you like. We just appreciate it if you credit the National Press Foundation and make it clear what we were doing today. If you have other questions, again, you can tweet them to us at NatPress, or you can type them into the chat window on the side of your screen. These are such complicated issues. Are there sort of, we've talked about some traps that journalists can fall into, the whole 20-week controversy. What other things do reporters need to be thinking about, be aware of when they're writing about this?
I think one thing is, I think as I mentioned at the top, is that it's very hard to find people on this issue who are neutral. Right. I mean, I look at I'm always in search of sources on this issue who are not on one side or the other. That is by far the most difficult thing. I'm always looking for, college and university professors, authors, although even, these days people who write books tend to be on one side or the other. I mean, that really is the most difficult thing. And people who tend to work on this issue tend to be advocates on one side or the other, and it's important to remember that most of the American public on this issue is kind of somewhere in the middle, and
that's what I was going to ask.
For years. Yeah,
this is an issue where people's opinions don't seem to change much.
No, they really don't. I think people have for years decided, think that abortion is bad, but it should be up to the woman to decide. I mean, and they've held this sort of contradictory opinion for almost as many years as abortion has been legal.
Has it become a more nuanced decision since we've been talking about late-term abortions, 20-week rules? Is there a middle ground developing of people who think, yes, we should have a right to abortion, but not at this time or not under these circumstances? Or is that developing at all?
I think the general rule has been the later in pregnancy you talk about abortion, the more the public doesn't like it.
Right.
And the earlier you're talking about in pregnancy,
right,
the more, forgiving the public is. And that's why when the argument is about birth control, the public is much more on the side of the abortion rights side. And when you're talking about things like 20-week bans, public is going to be more on the side of the anti-abortion side. I mean, because that's always been the way it's gone, and that's why the partial birth abortion fight was a huge win for the anti-abortion movement. And I think sort of last year when there was much more of a fight about birth control, that's fighting on the ground of the abortion rights side. It's sort of where you are in pregnancy the public tends to be much more which is not that hard to intuit.
Right.
But in general, the public has been, if you ask them about Roe v. Wade, they tend to say they support it, even though I think the public doesn't really know what is in Roe v. Wade. In general, they kind of think that it should be, a woman and her doctor's decision.
Right.
But they also tend to be fairly supportive of restrictions on it.
Right.
And that's been, and everyone will tell you, it depends how you ask the question. So polls are also, you have to be very careful when you look at polls on abortion. Right. But if you look over a lot of polls over a long period of time, that sort of fundamental, being of two minds on this issue has always been there. Abortion is bad, but it shouldn't necessarily be the government's role to make the decision for.
Right. When you say a lot of people don't really know what's in Roe v. Wade, are there things that journalists who are trying to put all this in context should know about it? I mean, Roe v. Wade is almost shorthand now for abortion. We don't even think of it beyond that, just as a signifier.
Yeah, and of course, I mean, the other thing that's important is that Roe v. Wade has been sort of reformed over the years, over the Supreme Court decisions. I mean, it was really very much changed by the Casey decision in 1992 or 3.
Remind us, please, what that was.
That Casey, took out, really threw out the trimester standards, and that's when they went back to viability. That's when they said that you can't, that it was actually Casey and not Roe that put in place the idea that you can't ban abortion before viability, and that you still had to have uh, exceptions for life and health of women. So even that's changed, and then of course in the case of the partial birth abortion ban, that changed it a little bit more, because that was the first time that they allowed a ban. So there were and that
So
that
it's
has
been
a health
more of an
exception.
iterative process,
It's
not
been
just
very
a...
much an iterative process. So there are a lot of very, very sort of fine points on this, and that's what I said sort of at the outset. You got to know a little bit about the law in order to understand this, and you got to know, and also because every time there's one of these laws, there's a whole spate of lawsuits or not. I mean, what was interesting about some of these early 20-week bans is that they weren't challenged at the beginning, because I think a lot of the groups were afraid that they might get to the Supreme Court and be upheld. That they really didn't. I think the first one that they really went after was Arizona, because, as we mentioned, Arizona was really more of an 18-week ban than a 20-week ban, and I think that was just too much for them to take.
So just to go back for a minute to something you said a minute ago about polling, and this I think is really important for journalists. You have to be very careful when you're reporting on polls to look at how they were worded and to look at who generated the poll. You know, there's a long and unhappy history of push polls in the United States from both all sides of politics, and on this issue that is key, because even a nuanced change in the wording of a question can change the outcome. So when we hear people say more than 50% of women in the United States think that there should be restrictions on abortion, you could probably find a poll saying just the opposite from a different group, and that's really key.
Yeah, but generally, what you tend to see is that people who think that abortion should be completely outlawed and people who think it should be completely available with no restrictions are the minorities.
Right.
And that has been true pretty much from the outset.
Right.
That almost that the vast majority of the population is somewhere in the middle.
I don't see any more questions from our audience there. What would you say is coming next? We know we have lots of lawsuits out there that are in various stages of ripeness and moving through the courts. We have a bill passed in the House, which is probably not going anywhere, in the Senate, and which the President has said he will veto anyway. The Supreme Court is, I guess, biding its time, waiting for the right. What do you think is coming next? And as journalists, where should we be looking to try to be ahead of the curve?
I think the contraceptive coverage mandate is going to end up in the Supreme Court in some way, shape, or form. I think that's one of the, particularly as it relates to through the religious organizations, to Catholic hospitals and universities. I think that's just inevitable. It's like, how do you? I mean, that's a truly. Can you? I mean, there's clearly an issue there. They have Catholic hospitals don't believe, and this is not a misunderstanding about whether or not the morning after pill causes abortion. They don't believe this is a clearly long-standing
belief.
Yeah, strongly held belief that against all forms of artificial birth control. There's a sterilization mandate in there. This is something they don't believe in, and this is something that the law says that they have to provide to their employees, and yet this is something that employees who are clearly not Catholic, or certainly students at universities, should get. So how do you make sure that they get them without requiring them to violate their religious beliefs? And this is this is clearly a conflict that clearly is going to have to be resolved, I think, by the Supreme Court. So I cannot see how that gets resolved without going before the Supreme Court. For a long time, I didn't think there was any question that the for-profit groups were going to have to simply obey the law. But I'm not sure anymore. There seem to be some interesting decisions coming out of some of the courts. So that one may end up in the Supreme Court too.
Which of those lawsuits, which would you say would be the one to watch? Is there a particular organization, a plaintiff that has a particularly good case to make?
It's hard to say. There's so many of them. I mean, people have been watching the Hobby Lobby cases in the for-profit ones because it's the furthest along. It's been to, although it has not, I've seen this sort of misstated, it has not been decided by the appeals court. The appeals court just decided that they had a case worthy of the lower court deciding it. They sent it back to the lower court. So that one, but again, it's a very large and well-known organization. So of the for-profit cases, that's one that a lot of people are watching. But it's just who gets there first. I think it's a matter of.
Right. So if you're a reporter covering a particular state or a region, what would be the best way for you to find out if there's a case in your area that you could go and report?
The National
closely
Women's
on?
Law Center is putting out actually a spreadsheet, I think, every week, pretty much, of where the cases are and the updates on them, which is great. The Beckett Fund, I think, is also keeping track, at least of the cases that they are involved in. So yeah, there are a lot of ways to keep track on what's going on with all of these cases. And then, on I think that one of these 20-week bans is probably going to reach the Supreme Court. It might be Arizona's. That's at least been through a court of appeals. But I think that certainly we're going to look for that to happen. But I think it's going to be one of these state laws that's going to get to the Supreme Court before. I don't think the federal. I'm not looking at a federal abortion issue getting to the Supreme Court anytime soon.
All right.
I mean, other than, well, I guess the contraceptive mandate is a federal law, but I mean anything. Any other federal abortion restrictions.
All right. Well, this has been fascinating. And again, we are going to send you links to all of these resources that Julie has mentioned, and we will put a recorded version of this on our website. It has been so great to talk to you today. Thank you so much for being here.
My pleasure.
On behalf of the National Press Foundation, I want to thank all of you for joining us. And we have a question coming in, so I'm not going to sign off quite yet. Do you have suggestions for resources on historical and current U.S. foreign policy around reproductive health? And the second part of that is, how influential is the U.S. stance on contraception and abortion internationally? How much influence do we have?
Boy, I used to cover this every year. There used to be this fight back and forth about Mexico City policy and about U.S. Not giving reproductive health aid to.
And that was true not just in Mexico, but
it was called the Mexico City policy because that's where that was developed. It was about.
U.S.
foreign aid to organizations that also performed or promoted abortion. That was the phrase, and it does. I have to say, it changes every time there's a Republican administration. It goes back into effect, and every time there's Democratic administration, they take it out. So it's sort of now we're into the fifth year of a Democratic administration. So we're not really fighting about it very much.
Right. Is there a particular resource or a place that you think follows that closely where a reporter could go for?
Yeah, I mean, USAID has been, there are a lot of organizations, and forgive me, I'm just sort of blanking because I haven't, the international part of it has not been active of late. Right. So I apologize for blanking because I have covered this very much over the years. It's just, I haven't done it lately.
There's another question here which is interesting. How are advances in medical technology affecting the parameters of this debate?
Well, as I said, clearly things like, there is now an abortion pill,
new medications,
which freaked out, for lack of a better phrase, the anti-abortion movement, because suddenly you can't picket every doctor's office who could be giving someone a pill.
Suddenly we're able to keep babies alive at younger stages of gestation. It has been pushed back some. And I think it hasn't been pushed back, and we do keep asking, it hasn't been pushed back a lot. It's still that right there, and that, there are a few babies who live at 22 weeks, but it's still around that 23, 24 week. The other thing I was going to say, though, about medical technology that people keep bringing up is that the advent of these, sort of what they call 4D ultrasounds, where, you see the baby, you don't just see the baby, but you see the baby moving, and at younger ages, I think has made, sort of women
and it really has, I think, made some women more cognizant of, wow, really is a baby. And I think that may have led to some. We didn't really talk about some of these ultrasound bills, but I mean that's one of the things that they're requiring women who want to have an abortion to see an ultrasound because look, it really is a baby.
Right.
But I think there's
and that
also
can be
this,
very powerful.
but they're also, I mean, and that's not just for not just the requirement of look what you're doing, but I think there's also this feeling, and fetal surgery and things that you can do. I mean, so there is some of that. Often later abortions are frequently and most often, I think, women who very much wanted and desired pregnancies when something goes wrong, and now more and more there are things that you can do in those pregnancies to help those women. So I think there's those parts of medical technology. So there are things but people have pointed out that the advent of more the ultrasounds, where you can see much more than just a blob on the screen, have had sort of an impact on what people know about development. But as I said, there's the knowledge now. We know more about how Plan B works and how it doesn't work.
Right.
So it works on both sides.
Yeah. So technology also something to watch. Before I wrap up again, have any more questions come in? And if not, then we will close. And again, I will thank you, Julie Rovner of National Public Radio, for being with us today. Thank you for watching. You can see this again at www.nationalpress.org. Thanks so much.